Good morning, everybody. I have a great topic to talk to you about today from physician leaders. This is Dr. Elsie Coe. I'm the CEO and founder of Lead Physician, which is a leadership program for physicians, and the CMO of American Endovascular and Amputation Prevention. Today, we're talking about maximizing your practice profits and your organization through a data-driven, disruptive billing system created and co-founded by a physician leader I'm going to bring on today. Um, Amazing story. Her name is Heather Signorelli. And before I bring her on, let me just show you a little picture about her and a little bit bio of her. So Heather Signorelli is an anatomic, clinical, and chemical pathologist, triple board certified. Recently, she was quoted on Modern Healthcare as a top 25 emerging leader, and really has been in the forefront of a lot of help with the revenue in a large healthcare organization where she oversees 190 labs and has been saving them literally $50 million a year. Now she has co-created this medical billing platform. So let me bring her on here. Hi, Heather.
Hi,
Oop,
good morning.
good morning. How are you?
I'm
Thank
doing
you so
great.
much for being here.
Thank you for inviting me. I appreciate it.
Yeah, I just want to mention before we get started that Heather is a graduate from the Lead Physician program.
Thank you. I am so grateful for that opportunity. It was one of those things that we kind of just stumbled upon, but really wasn't a place where we could grow, where we could put ideas out there, and has enabled us to build this company faster, but also without hesitation. When you're doing something new, sometimes you're a little hesitant, but it's that group mastermind that allows you to really just forge through and do the right thing and build your company.
Oh my God. Thank you so much for saying that, Heather. I'm just really amazed by how much you've already accomplished. And let's talk a little bit about this. In addition to what you do already, there's the perfect marriage. And I want to say perfect marriage because I want to show Heather and her husband, Troy Signorelli, have put together the perfect, not only they have perfect marriage, but putting together a very talented physician, so much talent there and many physicians out there. And if you're listening to this and inspired by this, I hope this gets to you and gets you started on something. But together with somebody in software development, somebody who understands the pain points, and then somebody who can help develop and get rid of those problems is unbelievable. And you've created this consulting business. And let's talk about your medical billing consulting piece here.
Yeah.
What's the pain point?
So first and foremost, we have a full service medical billing company that also offers some operational consulting and workflow analysis on as well. So, the perfect marriage is really, as a physician, as, somebody who understands the healthcare system. In my day job, I deal with the business side, which I love. My husband, who has worked in software and data for the last 20 years, really recognized that one of the pain points practices have is that they oftentimes have no visibility into what's going on in their practice in terms of revenue, right? So they may outsource their billing or they may have an in-house biller, but they don't really have those key data and metrics that allow them to say, gosh, there's something that I could improve here. Let me change that process or that workflow so that we can increase and grow revenue. And so it's that combination of the clinical piece, understanding, physician workflow, but then really understanding, the data you have and the software that you're using.
So where have been the major losses that you've seen, Heather? What's the feedback loop that's missing that you're talking about specifically?
Yeah, it's been pretty impressive. So some of the physicians that we've been working with over the last 6 months, they've really had no visibility, zero visibility into what their revenue is. And so really our goal is to put that data in front of them so that they can see, okay, how many clean claims do I submit every month? If there's an issue with that that's leading to denied claims or rejected claims and a loss in revenue, then we can say, okay, hey, let's change your front office process for registration and insurance accuracy, or change when you're collecting your deductibles and your copays so that you can really understand, okay, here's the data showing me what's going on with my practice. Here, let me change this front end process so that I can capture that more accurately.
Wow, and you know what? There's so many people who don't even know what they don't know, and you're just putting it in front of them, improving their processes, but also getting the data on the back end to bring to the front end. I love that.
And one of the things we've recognized is that the physician may have software in their office, but their medical biller may be using a different software that they don't have access to, or they may not be fully utilizing the functionality of their current software. And so that's where that partnership with my husband's knowledge that can kind of really help the practices grow.
So tell us about what software do you use? Is that something proprietary that he's created from scratch?
No, we actually are very agnostic in terms of what software we would be able to work with. So many physicians and practices already have a software in place. So our job is to come in, look at that, understand if that's the right fit for the practice. If it's not, then we can help them select a different vendor. But oftentimes, their practices often already have a good practice software with a good billing module, but there's just not that connection between the billing process and the use of the data. And so we can help with that. We know how complicated it is changing an EMR, practice management software. I certainly don't want to have to change that unless we absolutely necessarily need to. So our number one goal is to say, okay, what's going on in the current state with the practice? What software do they have? What functionality does that have? And then do we need to make changes depending on where you're at?
Right. So tell us a little bit about Troy's role. I know he's the CEO of this medical billing practice, I mean, consulting business, and you're more of the physician advisor. How much does he have to tweak that software for each individual practice? And maybe we should have had him on, but you said he's probably sleeping still because you're out there out west. So thank you for being on.
Yeah, no. So, his main first goal, and he runs the day-to-day business operations, and he works with our medical biller and coding team. So he is really front and center, and certainly we'll invite him to come back a different time. But he really his first goal is to sit down with the practice, understand what pain points they have, what's their process, and then really kind of dive into the software after the fact. So it's really that holistic approach. And as a DO physician myself, I am all about that holistic approach. And so then we can kind of really tailor what the practice needs over time. Again, our goal is to really understand what's going on in their practice, because not every practice is the same and the challenges are different for everybody.
Yep, and you know what? It's amazing how many people don't even focus on this piece and the feedback mechanism, and understanding the data and using that data to help you really maximize the revenue that's coming in. Um, we work so hard as physicians, and we think we're getting paid, but a lot of times it's just leaking on the back end, and you're just working for what 20% less.
Right.
So what would you think, what have you seen so far in terms of the percentage of, uh, improvement in the revenue, recapture of that revenue, on the overall, practice revenue?
It's not uncommon for us to see a 20 to 30% increase, depending on the practice. I would say the number one thing we've seen in our clients is that they are starting from scratch, meaning they have zero visibility into what's going on. They see money coming in, but they have no idea where it's tied to, or if it's good or it's bad. We also see our multi-physician groups. So when you have multiple physicians in the same group, say all in their internal medicine group, you can actually have reports that compare physicians to one another, not from the sense of like who's doing better, but in a sense of, is there an undercoding problem going on? What's the
Mm,
most interesting is that most physicians undercode when it comes to their practice. They're afraid of an audit. They're afraid to get in trouble. They don't want to do something that they shouldn't. And again, it's our personality, right? To just do the right thing as a physician. But what we're seeing is that their actually documentation and their clinical skill set and the review of the patient and what they're doing clinically actually qualifies for at higher code. And so the number one thing is really to have your physicians have a basic understanding of medical billing and coding so that they can code appropriately. In the US on an annual basis, $125 billion is left uncollected And so, this is an opportunity for us to make sure that our physicians are coding appropriately, again, with that comparability report.
Wow, this is so good, so valuable. Tell us a little bit about who your ideal customer is. Are they hospitals, organizations, physician practices, and how large and how small?
So we are really tailoring to private practice physicians at this time. And so that private practice could be, any size of physician group, but we really tailor to that outpatient private practice group.
Wow, thank you so much. And tell us a little bit about more of what your consulting business, National Revenue Consulting.com. I just want to put it out there. What other things are you guys involved in? I saw like your website says services. Just tell us briefly. I know the biggest part is the billing piece, but there's other pieces that we're not talking about.
Absolutely. So we can offer anything from compliance to credentialing, to even operational workflow analysis, to even bringing in laboratory tests. We have a team of people who can kind of help with any practice challenge, right? And that's where that evaluation of the practice really comes in handy, because we can say, okay, gosh, here's your pain points. Let's see, what makes sense for your practice or what you need. So that's really, a high level of what we offer, though we've got little other tips and services depending on, again, what the practice's pain points are.
Wow, thank you. Um, you're very impressive, Heather. What you've accomplished, what you've done already so far, and what you continue to do. I would love. I'm so happy to have you here to inspire other physicians to see that, what they're capable of. You're somebody who really understands that now and taking it full strength forward. And I just can't wait to see what else you do going forward. Tell us. Yeah, you just briefly told me before we got on about this free class that you're offering people, and it's catching wind right now.
Yeah. So, one of the requests we kept getting asked was, gosh, well, do you have a course on medical billing and coding? Because again, remember, as a physician, we are oftentimes, especially in outpatient practice, coding for our own charges. But there's no training or very minimal training in medical school, residency, and even right out of practice. And so we started, as of this weekend, actually, a medical billing and coding course for physicians by physicians. And so this is a free course that we're literally starting, and we're going to have small vignettes every week released. And so they can go and find this either on the Facebook group RevMD, REVMD, or alternatively can shoot me an email. This will be posted onto our website here in the next week. But we're really excited about this to help really any physician who wants a little extra training, or especially those residents or new in practice docs.
Yes, and I just wanted to reiterate what I talk about elite physician is when we're looking to increase our revenue or increase our income. It's not just about getting money for yourselves. It's actually allowing everyone wins when there's more revenue coming in. Your organization, your employees, the patients, and you being able to make more of an impact of what you're trying to do already. So. Make sure you're getting paid appropriately for what you're doing, and make sure you want to maybe check this out even if you don't go through this way. I mean, it's amazing what physicians can do when they put their minds to it and realize that they're more capable than what their training might have kind of geared them towards. So thank you so much, Heather. I want to again show your email, Heather at nationalrevenueconsulting.com. um, my name is Dr. Elsie Coe, and if you're interested in any kind of leadership training, come to leadphysician.org. We are starting at the end of this summer, but you can start early and reach out to me, and we can talk a little bit about what you need. And if you have a interesting topic that you think that other physicians and leaders can benefit in healthcare, go to email at info@drelsieco.com. I would love to hear from you. And any last words of wisdom, Heather, for us?
I would say for any of the physicians out there that are passionate about a topic or an area, and you're interested in going further with developing your own business, I say do it. Don't wait until it's the right time. There's never a right time. I still work in my day job, which I love, but this has been something that my husband and I have been able to do together, and we can help other physicians. And so just would say, get out there and do it.
Gosh, thank you so much, Heather. Thank you, everyone. Until next Sunday, um, keep doing what you're doing and dream bigger. Take care.